Bradford-on-Avon and Melksham Health Partnership has over 21,000 patients. The main site is in Bradford-on-Avon and we have 3 branch sites. We have 10 partners, 1 managing partner and we have 1 associate. We have around 100 practice staff and we are a GP training practice. The practice has an excellent patient participation group which consists of an active committee and a membership of over 100 patients. Patient feedback has always been important at the surgery as it provides us with guidance of how we're doing and which areas we need to do better. The patient participation group regularly meets with the practice and give us ideas for improvement and alert us to anything which isn't working as well as it could be. It was at the patient participation group's request a number of years ago that the practice set up suggestion boxes in the waiting rooms. These responses were regularly reviewed by me and a "You Said We Did" poster was put on display in the waiting room to list the changes that had been made based on this feedback. One of the changes at this time was to put arms on the chair which patients use to test their own blood pressure in the waiting room. We also carried out a waiting room music survey to review which type of music patients prefer to listen to while they're waiting for their appointment. When NHS England asked practices to implement the Friends and Family Test, the first thing I did was take the information to our patient participation group committee meeting for further discussion. It was during this first meeting that the PPG requested for the original suggestion box form to simply be amended to include the standard Friends and Family Test question. It was then agreed for patients to be notified about the Friends and Family Test survey when they check in for their appointment, on the practice website and via the screens in the waiting room.
My name is Mike Nolan and I'm a PPG committee member and the Friends and Family Test patient lead. At the beginning I put myself forward to collect the family and friends survey responses from the waiting room, and I do this on a twice weekly basis. I make special trips for this which I use as a form of extra exercise as I walk to the surgery. When I'm at home, I input the practice website ready for a member of the practice team to run off the monthly report and produce the responses for me to discuss at the next PPG meeting.
One of the challenges in the practice to implement the Friends and Family Test survey was to find the time to give the patient feedback the full attention that it was needed. But to consider how was I going to do this when we have an already busy working week. My management style is to involve staff wherever possible in projects so that workload is shared and the benefits are understood across the team. This also develops pride in what they are doing and motivates the team as well.
Hello, I'm Sarah Smith, Team Administrator for the branch site St Damian's Surgery in Melksham. The FFT process in the practice starts with me downloading the monthly FFT information from the website. I then attend monthly meetings with Debbie and Corinne to discuss the patient responses. When this process is complete, Mr Nolan from the PPG will receive an email of the responses to advise us of any changes that need to be made, then update the responses to the website and file the surveys to the patient information folders. I finally send an email to all staff whilst giving a special mention to colleagues who have been personally identified in the patient feedback. One of the FFT's positive changes that's been given patients the opportunity to have their feedback acknowledged and responded to. For example, we have introduced regular audits on our telephone lines to help us identify the peak busy times so we can educate patients the best time to call for non-urgent appointments.
Hi, my name is Debbie Hyatt and I am the team leader for the practice based at the main site in Bradford-on-Avon. I coordinate and chair the Friends and Family Test meetings on a monthly basis with my operational support team members. At this meeting, we review the Friends and Family Test feedback and decide on what investigations need to take place and implement actions. In my role, I ensure any agreed actions are taken forward with the wider practice team. One of the main benefits I feel of the Friends and Family Test is that it enables us to proactively resolve any issues before they escalate into a complaint. Therefore, I have included the Friends and Family Test survey into the Have Your Say patient information leaflet, which gives patients a variety of options to provide their feedback to the surgery.
My advice for practices implementing Friends and Family Test survey is that it's important not to be afraid of encouraging patient feedback. It's important that users of the service have the opportunity to have their say, and even if there are things that you can't change, patients really value acknowledgement from the practice. Finally, my main advice to practice managers is to get the team involved. I spend around 1 hour per month overseeing the final responses and the action plan, and I discuss them at quarterly patient group meetings. For my busy schedule, this is not only doable, but it's also a really satisfying use of my time.